Bernadette Mayuga, practical nursing student, and for today's video, I'll be going to assess postpartum head to toe by using bowel. First thing to do is perform hand washing. Wash your hands before assessing. Next is provide patient's privacy. Next is introduce yourself to the clients and explain what are you going to do and why it's necessary. Identify the patient's name and birthday. We are doing assessment. We're gonna touch body fluids, possible breast milk or blood, so wear gloves. Hi, good morning, Mrs. Aguirre. I'm Bernadette Mayuga, your student nurse for today. How is your feeling? I'm feeling good. Okay, that's great. For today, I'll be going to assessing you a postpartum assessment. Is that okay to you? Okay, it's fine. That's great. First thing to check out is the breast. The first B in a bubble he stands for breast. We're gonna ask mom what is her breast feel. Is her breast heavy or feel full, like full of milk, or feel normal? With that information, we're gonna assess breast. In assessing breast, you're gonna compare left and right. It's normal for one breast is slightly large and to have a different nipples and each breast. We are looking at the condition of the skin. If there's stretch mark on her breast, does she orange peel appearance or apple smooth? We are gonna use back of our hand and feel it's cool or warm or hatch. In reality, assess nipples. Different types of nipples. That's fine, I'll consider it's normal. We are assessing bruising, sock marks, cracks, or bleeding because it may indicate if she breastfeeding, this baby has good clutch. If that's the case, tell her next time to put baby on her breast. Put your Kali and let know it's how can I help you? We're gonna help for do that. Everything is normal. We're gonna move into U stands for uterus. First thing we want to do is make sure that mom is perfectly flat. Now remember he is postpartum. Perfectly safe to be her flat. Very important, it's totally flat when we want to do fundal check. Expose her abdomen. So, two hands for fungal check. One is to support of the bottom of the uterus and the another is to actually feel for the fungus. Go where the fungus is supposed to be. If she delivered today, it should be in the midline, which middle of the stomach and should be at the level of her belly button. The way we describe of the fundus is firm with massage or boggy. Ask patient if she already emptied her bladder. And also, advise patient that every 2 to 3 hours, try to empty her bladder so that the bladder don't full. It can help get the patient heal fast. So now we're gonna check mom's pad. If you can see, there's a lot of blood. If you see this, Ask patient, when was the last time you changed your pad? In this case, if 20 minutes ago, there's a lot, so it can be emergency. Or, if she said yesterday, that's why a lot of blood. You can educate, ma'am. Yes, you will educate. Change your pad is really important to know. Postpartum woman is high risk for infection. Even there's not a lot of blood on your pad, you should change your pad every 2 to 3 hours. In this case, my patient did not have an episiotomy, so I will just assessing any second to the third degree pairs and assess for any bleeding, redness, swelling, or discharge. We are done assessing this foot and we're gonna do the same thing to another. Put your hand behind the knee and endorse to flex the foot and ask her, any pain or tenderness when I do that? And she said no. No swelling, no redness, no heat. She's good. A final E stands for emotional status. We simplify assess by observation. How is mom acting? Is she happy? Is she crying? If she a lot of pain or feeling exhausted? And also, you also need to assess her support system. Overall, her emotional status is normal.